Good morning, everyone. You're here for our Homelessness 101 session. It's just a little bit before 9 o'clock, so we are going to wait for a few other folks to join us, and then we will start at 9 o'clock. Thank you.
Good morning, everyone. Welcome to the Michigan Coalition Against Homelessness Homelessness Advocacy Day of 2021. It's nice to see so many of you joining us on this day. This is our fifth day of getting together to talk about advocacy. We're going to start things off by talking a bit about the lay of the land. But before we do that, and we jump into the presentations by our terrific speakers, Laurel Birchfield is going to handle some housekeeping for us. Laurel?
Hi, good morning, everyone. This is Laurel. I'm the Associate Director at MICA. Thank you for joining us. We're really glad to have you. And for those who are coming from legislative offices, I know that you have very busy schedules and have a lot that's happening in Lansing right now. So thank you for taking the time to join us and our partners and to learn more about homelessness in our state. A couple housekeeping notes that I wanted to share with the group. We're using GoToWebinar, which is a platform that has a couple different options for you for interacting with us during this presentation. We will have everyone on mute, but there is an opportunity to send in questions at any point by using the chat or the question box. You can just type those in. And we do have Allison Green, who is another staff member at MICA, monitoring that question and chat box, and she'll be doing questions at the very end of our presentation after you hear from all of our state partners. If you are in a space where there's no background noise and you have a question that you need to verbally ask at the end of the presentation, you can raise your hand and we can go through the process of unmuting you. But please feel free to use that chat or question box at any point. We are recording this session, so if you, again, are from a legislative office and you'd like to share this content afterwards with other members of the staff, we will be sending this out so you can share the recording. We'll also be following up with the materials, which include this presentation, the reports that we'll be discussing, and some additional materials to help you with your constituent relations. For our advocates who are joining us for advocacy today, this session will go until 10 o'clock. And at that time, we'll be moving over to our Zoom room to be talking about our policy priorities and how to get you involved in our advocacy for the day. I'll be posting that link in the chat box when we get closer to 10 o'clock. But I think that's all that I have for housekeeping. Just another thank you to everyone for joining us, and I will turn it back over to Eric. Thank you.
Great, thank you, Laurel. Okay, well, again, thank you all for being here today, helping us empower communities and end homelessness across Michigan. We're very excited to cover some topics today, starting off with what we call Homelessness 101, to give you the lay of the land, where we're at with respect to the numbers and where we're at with respect to the programming. So let's talk a little bit about the agenda very quickly. We're going to start off with the Homelessness 101 that will discuss the annual report, the annual data report that's put together to give us a picture of what's happening across the state. We're going to hear from the Interagency Council on Homelessness and the campaign to end homelessness. We'll also hear from the Department of Health and Human Services and from MISHTA regarding their programming. And then we're going to look at what's happening beyond COVID-19. And then we'll have some questions at the end. So let's go ahead and move on to the next slide. And I'll make the introduction of our speaker. All right, the Homelessness Annual Report, Homelessness in Michigan for 2019. Jerry Leslie is the project director for the Michigan Statewide Homeless Management Information System, and he is with us today to cover this report. Jerry, are you on?
I am here, and good morning, everybody. And we want to welcome you to kicking off this meeting and looking forward to a great productive day. So, Allison, if we want to go to the next slide. So starting off, in 2019, we had a calculated or estimated number of about 61,000 persons who experienced homelessness within the calendar year 19. This, of course, is a calculation based on those who participated in our HMIS or Homeless Management Information System, as well as calculating those who may touch agencies that are outside of our HMI system, including DV agencies and some non-participating shelters. And if we can go to the next slide, Allison. There are a couple of key things that we had for successes that we're very excited to announce in the annual report this year. First of all, achieving public safety through cross-sector collaboration resulted in a 93% successful parole supervision exit for returning citizens that participated in the HCV or Housing Choice Voucher program, which was a big success. Also, we continue to see declines in youth, though these are the young adults age 18 to 24, also veteran homelessness and family homelessness. And the following communities, which include the counties of Wexford, Missaukee, Manistee, and of course Ingham County, which also includes the cities of Lansing and East Lansing, achieved what is recognized as ending veteran homelessness during the calendar year of 2019. Also, we experienced legislative victories in a number of very key areas. Number one, we secured an increase in funding for the Emergency Shelter Program, which is administered by the Department of Health and Human Services. So the per diem went to $18 when this was the culmination of a series of increases from 2017 when the per diem was $12. So we've really increased that by 50%. And this is a huge win. A big thank you to all of those who've been advocating, and also all of our legislative partners in the Michigan State Legislature who've really worked hard and tirelessly to make this happen. Also, we've created access to free birth certificates for people who are experiencing homelessness, which is another huge win to get those people access to services. Some of the challenges we still face, though: number one, average monthly income for a person experiencing homelessness is $662, which is, as many of you can easily anticipate, it's not enough to afford rent and living expenses in Michigan. Also, more than 40% of the homeless population in Michigan have long-term mental or physical health conditions. And despite this fact, people experiencing homelessness are less likely to have health insurance than the general population. Although I will say the one thing that we really do see that is very positive is about 3/4 of our persons who are experiencing homelessness do have some form of health insurance, which is a positive outcome. And then also, despite deepening our understanding of how far-reaching racial inequality is within the housing and homeless service delivery system, we still have a lot of work to do to transform our services to become much more racially just and equitable. And we're going to talk about that in just a moment here. So looking at outcomes, there are a couple key measures that we look at to really understand how effective we are in the work to prevent and end homelessness. So we've really focused on 4 key measures that form the basis on how we evaluate programs. The first is reducing new episodes of homelessness. Second is going to be reducing the length of time that persons and households are homeless. Number 3 is going to be to increase the percentage of discharge to stable housing and retention in permanent housing. So as people exit episodes of homelessness, are they going to permanent housing or are they staying in permanent housing? And then, of course, number 4 is going to be related to that. It is reducing the number of returns to homelessness. So when people go to permanent housing, are they staying there and not returning to homelessness afterwards? Now, a couple of things we really want to focus on, and this is going to be a really big focal area of our work within the Interagency Council on Homelessness and the Campaign to End Homelessness over the next few years is that we continue to see some pretty big disparities when it comes to racial equity around the issues of who are homeless within the state of Michigan. So for example, if you look at this, only 14% of Michiganders are Black or African American. However, if we look at our homeless population, we see that 52% of people who experience homelessness in the state of Michigan are Black or African American. And this trends much higher than the national average. And one thing I really do want to stress is this becomes more acute the more we go into this. So there's this term we call chronically homeless, which really indicates those people who have the most acute episodes of homelessness. When we go into looking at those persons, the numbers jump to 57% of those experiencing chronic homelessness are Black or African American. So we see that on a continuous gradient, if you will, that the more severe, more significant a homeless experience is, the more likely a person is to be Black or African American. So the one thing that we're really starting to look at from the homeless service delivery system is asking the questions, how can we begin to design a system that is going to be more equitable in transitioning people of color from episodes of homelessness into permanent housing and helping them to maintain that permanent housing. And then focusing on health disparities, one of the things that we see is that people who are experiencing homelessness typically have a higher degree of significant health disparities than the general population. So when we look at our homeless population, we see that 44% of them have some form of disability, with the leading cause of disability in our homeless population being a significant mental health condition, which makes up about 2/3 of the people who have a disability who are experiencing homelessness. The next highest is going to be physical health condition, substance use disorder, which many people that may be surprised by this, but it is only 26% of those who have a significant health condition who are experiencing homelessness. And then that's followed by chronic health condition and developmental disabilities. And it is worth noting that in many cases, people who do have disabilities may have 2 or more conditions because of the nature of their episodes of homelessness and some of the health issues that they're experiencing. So looking at our homeless population, the one thing that is encouraging is 83% of persons are maintaining some form of health insurance. And because of all the good work that we've seen with the expansion of Medicaid and sustaining of Medicaid, we're seeing that 75% of the people who are experiencing homelessness are utilizing Medicaid health insurance, which very realistically is a huge win for all of us across the state, because we are keeping these people insured and having them access to health care and resources. Just the biggest thing is making sure that they're able to get access to equitable resources around healthcare if they do have some of these conditions and are maintaining treatment for those conditions. And we are going to, Eric, turn it over to Chris Brady.
Thank you, Gary. Great job. Appreciate that. It's always wonderful to get the view of what's happening across the state of Michigan. I think it's important for us to realize that we're making a lot of progress in many ways. We have a lot of great outcomes that take place, but when we see the report, we understand that there are some areas that we really need to be focusing on. We really need to be strategic in how we're addressing the issue of homelessness in the state of Michigan. And that's why it's great to have partners getting together to think about this strategically and working collaboratively. And so I'd like to segue into a discussion about who is involved in this effort across the state, what kind of programming and resources are brought to bear to assist in this effort. And we're going to start off by having Chris Brady speak. She's the Director of Community Services for Northern Michigan Community Action Agency. She's also the co-chair of the Michigan Homeless Policy Council. So Chris, if you could lead us down the next path of the righteous here.
Great. Good morning, Eric. Good morning, everybody. Thank you for all for being here. I'm just popping on my camera so you can see that I'm real, and I'm going to turn it back off because I'm coming to you from Northern Michigan, and I'm not sure if it's going to afford me the bandwidth to be on film or on camera the whole time. But welcome and thank you for being here, everyone. I also want to thank Micah for the opportunity to explain how the campaign to end homelessness is structured and how it is working across Michigan to end homelessness in every community. Next slide, please, Allison. So this is the general structure of the Michigan campaign to end homelessness. The campaign to end homelessness is a large statewide network of collaborators and dedicated communities working to end homelessness. It is sort of headed up by the Michigan Interagency Council on Homelessness, which I will be explaining a little more in a minute. And underneath the Michigan Interagency Council on Homelessness is its advisory working group called the Michigan Homeless Policy Council. And then feeding into these two groups are local continua of care that are in every county in Michigan, whether it's a local working body or a urban continuum of care. Every community, every county is represented or has a continuum of care that works to plan what they need to do to end homelessness in their community. Within those continuum of care, each community has a HARA, which is a Housing Assistance Resource Agency. The intent of the HARA is to provide sort of a one-stop shop or a general place of entry for folks that are homeless or trying to assist homeless folks to go to then be directed to the resources within their community that are most appropriate for them. So we have HARAs in each community, and then we have hundreds of local partner agencies also within each continuum of care. Service partners, shelter providers, veterans assistants, community health clinics, all local service partners collaborate within the continuum of care in each community. And then within the MHPC, we have work groups that we have established that are addressing current and important topics. Currently, we have a social and racial justice work group. We have a VI SPDAT, which is a technical term, which would indicate to you that they are addressing the technical aspects of ending homelessness. The SPDAT is a tool used by practitioners to determine the acuity of someone's homeless episode and help them figure out how to direct that person to the best resource most appropriate for them, whether it be shelter or permanent housing or supportive housing, etc. So the VI SPDAT group is working on some of the technical aspects of the tools that we use. And then we have an action plan implementation group that is working to create the strategies to complete the goals of the action plan that we are currently working under. And then the MHPC has 3 standing committees within its bylaws: communication, training, and membership. Communication is what we use to communicate pretty much everything up and down the line across the state, policy changes, new funding opportunities, training on how to do things like use the VI SPDAT or all kinds of stuff, keeping everyone as best we can informed of all of the shifts in, especially with COVID. This has been incredibly important, and there's been a huge effort to communicate, and it's been astounding to me to see how well we are getting the word out when things are changing and opportunities arise and we can access and advocate for what we need to end homelessness. So the communication is a really key part of what MHPC does. Training is how we keep our communities up to capacity to keep them using the most current and successful best practices to end homelessness. And then there's a membership community which keeps the membership of the MHPC and the ICH as diverse and geographically representative as possible so that all communities across Michigan can get their voice heard at these different tables. Okay, next one, please, Allie. Okay, so the Michigan Interagency Council on Homelessness was established in 2015 by Governor Snyder through Executive Order 2015-2. It is made up of directors or their appointees from 7 state departments. There's 1 representative of the courts and 4 representatives of the general public. So my seat on the Michigan Interagency Council on Homelessness is a general public seat, but I represent Michigan Community Action Agency. So what does the council do? The council, within the executive order, is established to develop a plan to end homelessness in Michigan. And we'll talk about the plan in a moment. Then we monitor and oversee the implementation of the plan. We help make those strategies and action steps, and then we help to convene the collaborators and keep the information flowing to the communities and implement the plan. Then we provide an annual progress report to the governor and the legislature, which is what Jerry was giving you a lot of the highlights from just a little earlier. We identify and maximize leverage resources. We facilitate the collaboration among state, local, and federal partners to accomplish the plan. Next slide, please, Allison. Okay, and then the advisory group to the MICH is, again, the Michigan Homeless Policy Council, which was also established in the Executive Order 2015-2. There are always two co-chairs of the MHPC, myself currently, and Mercedes Brown from CSH are the 2021 co-chairs. We want to be sure that you know that we are a resource to you. My contact information, I think, was up earlier and will probably be up at the end, and I want to be sure that anyone with questions or that wants to get connected or hooked into any of these groups on any level can reach out to me or Mercedes, and we can help direct you and get you connected if you need to be. So the members of the Michigan Homeless Policy Council, again, this is a simple job to chair this group because these are amazing and dedicated human beings that work tirelessly on behalf of the homeless constituents of Michigan to end homelessness. They are creative, they are collaborative, they're innovative, and basically we just sit back and watch the work unfold. But they are representative of the Michigan Department of Health and Human Services, MISHDA, Michigan Coalition Against Homelessness, CSH, which is formerly Corporation for Supportive Housing, Michigan Association of United Ways, Community Action, which is where I represent, Department of Corrections, Department of Ed, Department of Natural Resources, Department of Technology Management and Budget, Michigan League for Public Policy, and then we have two veterans groups, the Michigan Veterans Affairs Agency and the U.S. Department of Veterans Affairs. And then importantly, we have 5 members of the general public that are elected alternately every 2 years, and they represent the diverse geographies and the diverse constituencies that we are working to serve. Okay, next slide, please, Allison. What does the Michigan Homeless Policy Council do? Now, again, it is the advisory group to the Michigan ICH. So everything we do on behalf of the ICH, and the ICH oversees our work and approves what we are doing. So we publish on behalf of the ICH the annual report on homelessness in Michigan. We create on behalf of the ICH the plan to end homelessness for Michigan. And then we facilitate the plan work to end homelessness by convening working partners and communities across Michigan through those continuum of care. And within all the boots on the ground, we try to get everybody together to work within the plan. And it's a big effort, but there are a lot of people working on this. We advocate for needed resources and policy improvement. We engage the field. We provide training and peer learning. Some of you may be familiar with the annual homeless conference. Pre-COVID, that conference was about 350 attendees every year. We pivoted just like everybody else, went online. I think it was a great success last year doing that. And we do, though, look forward to being back in person because those of us working in this field really need to look in each other's eyes and get a little strength and a little rejuvenation every now and then. And that'll be a great day when we're all back together. We have established learning communities, and we provide local trainings. And then we provide a platform for collaboration and accountability among partners. Next slide, please. Thank you. So the Michigan's Campaign to End Homelessness State Action Plan, currently we are working within the 2020 to 2022 State Action Plan. As you can imagine, the pandemic has slowed us down considerably. Everyone has been working very hard to keep people housed and safe within these pandemic circumstances. So we may extend our year. We'll see how it goes after another 6 months or so. But as a reminder, the state action plan works under these very important guiding principles. We strive to address racial disparities across the statewide homeless response system. So we are weaving across all of our strategies ways to address the racial disparities that Jerry spoke about earlier. We strive to authentically include the participation of persons with lived experience, because we know that they have the perspective and the information that we must have in order to end homelessness. We need to hear and include and emulate those with their knowledge and wisdom with lived experience, so that we can really do a good job of eliminating the factors that lead to homelessness. We strive to effectively leverage cross-sector data to drive results. And we strive to drive innovation, collaboration, and strategic alignment across systems of intersection of housing and security. Kind of spoken about those. In our current 4 main action plan strategies for 2022 or through 2022 are to increase the access to safe and affordable housing. I think every community in Michigan is aware that they need more safe and affordable housing if we're going to get every citizen in Michigan housed. It's not a new concept, but we are working on that with the other partners across the state that work to build housing. We're focusing on ensuring that the system diversion and homelessness prevention are solidly in place within each community. So that's sort of a shut the front door to homelessness as we work with folks to divert them from becoming or prevent their homelessness before they end up in a shelter. This is a strong strategy for ending homelessness if we can stop the flow into homelessness. And so we have best practices and trainings constantly going on, as well as tools being employed to divert folks from homelessness. We're working to advance cross-sector system alignment to impact social determinants of health. We work closely with all of our partners in the social determinants of health, and the movement within the healthcare community have brought us some really incredibly strong partnerships, and we could talk about that all day. And then we're working to improve the quality of the statewide service delivery system, and that's ongoing. How are we delivering services, and are we doing it with all of our guiding principles in mind, and are we doing it where we're actually seeing, as Jerry said, that needle moving on those very important measures to end homelessness year after year. Okay. Next slide.
Great, thank you, Chris. We appreciate you being here, giving us that overview. Certainly, I think reflects the fact that we are talking about strategies and how are we working together in a strategic fashion, how are we collaborating across systems at times, but also most importantly, with the partners that exist throughout the state of Michigan. So it's great to have that presentation about the Interagency Council on Homelessness, so you understand that structure, and the Michigan Homeless Policy Council as basically the worker bees carrying out the work underneath the Michigan Interagency Council on Homelessness. And then, of course, the Campaign to End Homelessness, which you all have a role in if you so choose. Now, key partners within the Campaign to End Homelessness include the Michigan Department of Health and Human Services. For many, they don't realize the important role that they actually play in the work fighting homelessness in the state of Michigan. So we're very delighted to have them to speak today. Paula Kaiser Van Dam, who is the Director of the Bureau of Community Services with the Department of Health and Human Services, is going to be discussing some of the programs that really relate to the fight against homelessness. So Paula, are you on and available?
Good morning, I am. Thank you so much, Eric. Appreciate the invitation to be part of today's presentation. As Eric mentioned, my name is Paula Kaiser Van Dam, and I'm the Director of the Bureau of Community Services at MDHHS, and within that bureau includes our housing and homeless services. But before I jump into the specifics, I just want to really reiterate that MDHHS is a very committed partner in this work to end homelessness in Michigan, and we believe that it's core to the mission of our department to really to have this as a priority and to ensure that this population receives the, services and supports that they need in order to get housed and then remain housed. So today I'd like to just walk through a few of the programs that we administer as part of our housing and homeless services, and then talk a little bit about a few other initiatives that we have going. So first, we're fortunate to administer a portfolio of about $30 million a year, including both emergency shelter and some permanent supportive housing assistance programs. So the programs that we have the pleasure and honor of administering is Path Street Outreach. So that is a competitive grant program that is awarded to local communities to provide resources to hire individuals who will often peer supports, et cetera, who will actually go out into the streets, into places where we know encampments, et cetera, and engage with individuals who are unsheltered, and to try to begin to engage them in services, and in hopes that we can not only bring them into shelter, but ultimately get them to engage so that we can find housing for them. We also are the largest funder of emergency shelter in the state. So the emergency shelter program is a combination of funding both from the general fund dollars in TANF to really provide that safety net support for individuals who don't have a place to sleep at night, and ensures that they, have a place to go to that's safe, et cetera, that will allow them to connect to services to begin on their path to finding housing. We also administer a portfolio of Hud homeless programs, both rapid rehousing and permanent supportive housing. So rapid rehousing is temporary rental assistance for folks who find themselves homeless, but may have some income, but just have kind of fallen on hard times. And then our permanent supportive housing portfolio is really a housing resource that comes with a full-time housing subsidy, an unlimited, housing subsidy, as well as ongoing case management and supports. And so that is usually a resource that is provided to those individuals who are experiencing homelessness, who've had many episodes of homelessness, who've had long lengths of stay within a homeless system, et cetera. So more of our chronic homeless population is typically the ones who are, receiving that permanent supportive housing portfolio. We have those programs operating both as part of the balance of state continuum, and then a couple of the independent jurisdictions we administer programs on their behalf as well. We also have the homeless and runaway youth funding. So that is new. It used to be administered out of our child welfare administration, but a couple years ago, about a year and a half ago, we were asked to begin to take that on in our portfolio, and we absolutely agreed to, and think it makes sense to kind of have the continuum of programming within this within our housing and homeless services. And so that is funding that is provided to agencies across the state to address youth, homeless runaway youth, and provide supports to them and helping them find housing, et cetera. And then the final program that we operate is our Housing Opportunities for Persons with AIDS, or HOPWA. And it's just as it sounds, it's resources for individuals who are have HIV or AIDS, and it provides housing resources and supports for them. Next slide. In addition to some of the direct programming that we do, some of the other things I wanted to just touch on to kind of give you some idea of what the work looks like here at the department is we have a Health Through Housing initiative, and in that we were really lucky to partner with the Michigan Coalition Against Homelessness. They are our statewide administrator for the homeless data. And so we were able to bring the statewide homeless data into the state data warehouse and begin to match it against some of our assistance programs at the department. And the first data match that we did was against Medicaid. And if you were listening, I think Jerry covered that at least 75% of the homeless population is currently covered with Medicaid. So we were able to do that data match to really begin to understand the utilization of Medicaid for that population and what that looks like and how that compares to other folks who are other Medicaid beneficiaries. And so what the data really bore out, which is what we thought it would, but it was nice to have that confirmation, is that our homeless Medicaid population is more expensive. They're higher utilizers. They have higher rates of emergency room use, higher rates of inpatient stays. They have, significant numbers of chronic health conditions, etc. And so we used that data to do a frequent user pilot. So through the matching data, we were able to identify by name individuals who had high ED utilizations, high Medicaid costs, some inpatient stays, and they were homeless. And so we were able to, MSHA was very generous in giving us some housing choice vouchers, and we were able to pay for some case management. And we did a frequent user pilot in 3 communities across the state. It was in Washtenaw, Muskegon, and then the Grand Traverse area. So we were really thrilled to sort of see. We're waiting for the final evaluation to come out of that pilot, but we're excited to, to share that it did work. We saw that the number of inpatient stays in hospitals and the number of ER visits was reduced, and overall health increased as a result of stable housing provided. And so we're continuing on with that sort of frequent user pilot. We're partnering with some communities who are using some of their local housing resources and want to prioritize those folks who are homeless and are high utilizers within Medicaid to provide housing for them. So really excited about that on an ongoing basis. We're also continuing partnerships with healthcare in general. We're doing some work with our Medicaid health plans around helping them understand when they have a beneficiary who is homeless, what that means. Also trying to help do better care coordination between the health plans and our housing providers. So there's some new work that's happening in that space that's really exciting, that we're really happy to sort of see. Also trying to kind of figure out how we might be able to provide some data back to the local level, that as they're assessing homeless individuals for their overall severity and acuity, as Chris talked about through that sort of VI SPDAT assessment, that there might be some additional information that we could provide that would give some idea about if they have like some high risk healthcare related things, without sort of getting into HIPAA or we wouldn't be breaking any HIPAA laws, but providing some real-time data around their overall health that could be used to augment what they get as part of that VI SPDAT process. So really excited about that. Also, our department, obviously, as someone who, a department that took the lead around the COVID-19 response, we were very active in what that looked like for the homeless population. So we worked very closely with both our public health departments and our local homeless providers to ensure, that they had the best information possible. So education and direction. We also provided lots of PPE, so face masks, face shields, hand sanitizer, cleaning supplies, etc. Some of that was purchased through some dollars. Some of that was donations that we received and were able to provide and prioritize to ensure that our shelters and other places were able to receive those items. We also coordinated, because of COVID and having homeless or individuals testing positive, they needed a place to go to quarantine for the appropriate amount of time. So we worked collaboratively with local shelters and local public health departments to stand up non-congregate sheltering and to provide leverage funding from FEMA to do that. And that initially that required a 25% match, and we were able to provide that 25% match to local communities so that they weren't incurring any costs on their own to be able to do that. And then we also worked very hard around an overall testing strategy for the homeless population, and now coordinating around an overall vaccination strategy for the homeless population. So I'll stop there.
Well, very good, Paula. Thank you so much for being here. I really want to thank Paula for her commitment to the population that we are working with, and the commitment on the part of the Department of Health and Human Services. As you could hear from the presentation, they really do have a broad array of programming that they're involved in that affect the individuals that we are currently serving. So it's really important for them to be at the table, which they are, great collaborators, and we want to thank them for their role. So thank you so much, Paula, for being here and giving that overview.
You're welcome. Thank you.
And so now we're going to move on to another significant partner in the battle against homelessness in the state of Michigan, and that would be the Michigan State Housing Development Authority. And Kelly Rose, who is the Chief Housing Solutions Officer for MSHDA, is here to give an overview of MSHDA programming. So Kelly, welcome.
Thank you, Eric, and good morning, everyone. Go to the next slide, please. So I'm going to take you through today some of MSHDA's homeless programs, and my email is there on the slide if you would like to get a hold of me at any time after this presentation, or if you have constituent issues that you'd like to talk through for people that are experiencing homelessness. Homelessness is definitely at the core of MSHDA's mission, and we tackle it through a number of different federal funding sources and programs that we administer. The first one that I'll take you through is the Emergency Solutions Grant program, and that's funded from HUD, and we typically have about $10 million of funding each year, $5 million coming directly from HUD, and then we match that with MSHDA funding, $5 million each year from MSHDA. And we do have more funding due to the CARES Act, so an additional approximately $40 million for the next year and a half of funding to support serving people that are experiencing homelessness. So the Emergency Solutions Grant Program helps in a number of different ways and provides pretty flexible funding to our homeless service providers to address and to be able to support people experiencing homelessness and getting back into the path of housing. So it funds street outreach. Paula covered this before, of really just going out and meeting people where they're at if they're living outside, and working to bring them inside and to work them towards housing. It provides funding for emergency shelter. It also provides funding to help keep people out of homelessness, so homelessness prevention work, whether that's helping someone catch up on their rent before they're getting evicted, or if it's a doubled up household where there's two households living in the same home and that's just not sustainable, helping them get rehoused and preventing homelessness. And then rapid rehousing. So that's taking someone that is currently experiencing homelessness out of emergency shelter and providing them with short-term rental assistance, typically between 6 to 12 months of assistance, and helping them get back on their feet, and also connecting them with other community resources to help make their housing sustainable. And the Emergency Solutions Grant is distributed statewide. All 83 counties are covered by this program, and we do that through the continuums of care throughout the state. So continuums of care are essentially just groups of homeless service providers that are serving the same geography, that work together towards that coordinated approach to try to make sure that if someone's facing housing instability, they know where to go and they know how to get services. Next slide, please. Our next step is our Housing Choice Voucher Program. So we are the largest statewide Housing Choice Voucher program in the country. So with MSHDA, we administer about 28,000 vouchers statewide. And the budget for this program is a little less than $200 million each year. We use a homelessness preference within this program to really try to target our resources towards those that are most vulnerable. So we partner with the continuums of care across the state to populate our homeless preference waiting list, so that when we're able to offer new vouchers to people, we always offer them to homeless applicants first. Housing Choice Voucher is not a time-limited program. People can stay on it for as long as they need to, and participants pay 30% of their income towards their housing, and then the housing voucher pays the rest of the rent. This program we also use in conjunction with our low-income housing tax credit program to create permanent supportive housing units. Next slide, please. And now I'll go into the low-income housing tax credit program. So this is a federal program out of the U.S. Treasury, and it provides tax credits and capital funding for developments to create new affordable housing. And at MSHDA, we use 22% of this resource, so nearly a quarter of this resource is used each year to create permanent supportive housing developments. So these are developments, sometimes they're 100% for supportive housing tenancies. Sometimes it's a mixture of, a third of the units are permanent supportive housing and 2/3 of the units are general affordable housing. And typically we can fund about 6 to 8 new developments each year with this program. And permanent supportive housing really helps serve those that are most vulnerable in our community. And as Paula talked through before, many of these folks are very high Medicaid utilizers and persons with disabilities that housing them can achieves like many public benefits, as well as is just the right thing to do to get people off the streets and to help our most vulnerable regain housing so that they can sustain themselves. These are our 3 main core programs that operate on an every year basis. We do have new programming that's starting. The COVID Emergency Rental Assistance Program is just kicking off. It's obviously a very large program towards helping those that are behind on their rent. And we'll have new programs that will be coming out later this year from the American Rescue Plan. One related to home ownership and helping those folks stay in their homes, and some other new programs that are coming out of the American Rescue Plan that we're really looking forward to administering, and to being able to help secure people's housing so that they can remain stably housed, especially during this critical time. But we always know that access to affordable housing is a key thing for everyone, and is something that's really first and foremost in MSHDA's mission. Thank you.
Great. Thank you, Kelly. Great job of giving that overview. I think it's important for everybody to think in terms of MSHDA being one of those backbone organizations that's helping to lift individuals out of homelessness. The Housing Choice Voucher is an incredibly important piece when we think about tools in the toolbox, and also when we look at ESG and other funds that come through MSHDA. Those are the resources that go to communities and are providing services where the rubber hits the road. So very important partner at the state level, assisting those at the local level. So thank you, Kelly, for giving us that overview. We're going to, I think at this time, ask for questions. So if anyone has any questions, please feel free to toss them in the chat box, and we will direct them to the most appropriate individual or individuals to try to answer them. And likewise, if you look in the chat section, you will see the contact information for our speakers as well, if you weren't able to capture it from the slides when they were introduced. So do we have any questions, Allison or Laurel?
We do. The first one that came in, I think, is probably for Jerry. It is asking, how are undocumented or underdocumented and mixed status families data collected in HMIS?
Very good question. And I'm just reading the rest of the question here. So when we have persons come into our emergency shelters, any of our HARAs, which are basically what we call coordinated entry or intake centers for those who are experiencing homelessness, that information is collected within our service delivery system within HMIS. And we're able to take that data and use that data to inform some of the policy decisions and policy making. And one of the key things that are being asked is with mixed status families. So one thing, we do not directly collect information on citizenship for within the data set, which again is not there. However, we do collect extensive information about the various different groups of people of color, with the intent and focus that we are able to break that data down and use that data to inform our decision making when it comes to outcomes for homeless services. One thing that is really important is historically we've made kind of clean breaks between different racial and ethnic groups. However, here in just the last year or two, we've actually begun looking at those who are mixed race or multiple races in as a separate category, really within demographically, to understand what are some of the unique challenges that people of multiple racial or ethnic backgrounds experience. And we're going to be using that data in the future to do some more evaluation.
Okay, thank you. The next question is asking how survivors of homelessness can get involved with the Homeless Policy Council. So possibly Chris could answer that one.
Hi, okay, sure. So each year we will elect general public members to the Michigan Homeless Policy Council. So if you would like information on how to put someone forward for election, we actually just had our election. So all the seats are full currently on the formal council board, but we would love to have people volunteer on any of our various committees and get to know them and help them figure out where a good place or what a good fit for service is for them, and then potentially looking for folks to run for one of the open seats in the future. So every year, open seats will open up, and we'll bring in new folks. So there's an opportunity every year to be elected to the actual Homeless Policy Council, but there is a constant opportunity to join any of the working groups or join forces locally in the work. So if you'd like to send me an email, I can talk with you specifically about a particular person or persons.
Thank you. And then the last question that we have right now is asking if the youth homeless and runaway, is the youth homeless and runaway transferred over this program sector due to the issue of aging out within foster care? So I think that they're asking where the youth come from for your program, Paula.
It's a combination where it could be some of the youth are aging out of foster care and have no place to go. It also could be, families have kicked their children out and they have no place to go, where there's often that's for the LGBTQ community, youth, often there sometimes can be, a disconnect or a family fight where they're no longer allowed to be home and they're in need of a safe place to be. So it's both a combination of folks for whatever reason who seem to have a separation from their family, as well as those aging out of foster care.
Thank you. And another question actually did come in. They're asking if there'll be a COVID-19 specific data report released anytime soon.
I guess I would ask sort of for clarification around specifically for the homeless population in terms of like how many positive cases or the work that was done. I don't know. There aren't plans at this point to release something like that, but if there's an interest, I mean, we'd be happy to look at what we have and what we could provide.
I think that's all we have right now. Nope, sorry. Okay. Can there be a program to advance HCV renters to obtain ownership to open more availability if rental units for another survivor to obtain housing with their HCV? So I guess that question would be for Kelly.
Yes, there is a program within our Housing Choice Voucher program that moves people towards home ownership. So that is a component of the Housing Choice Voucher program. It's called Key to Own program, and people are able to use their voucher towards becoming a homeowner. And many times within the first few years of that, they transition off the voucher completely, then freeing up that voucher for a new person to be able to come onto the program.
Thank you. We have a question asking how many counties in Michigan do not have homeless shelters?
Honestly, I don't have that figure in front of me. I would need to ask staff to pull that for us. We could certainly, if Mike, if you guys could take the person's name and information back, we'd be happy to figure that out and report that back out.
Thank you. Someone is asking if someone can expand upon the non-congregate shelter program.
Sure. This is Paula. I'll take that. So when a couple of things. One, the guidance that came out for homeless shelters initially as COVID, was, coming into play here in Michigan was most of our shelters are congregate shelters, right? We have, lots of people in a very small amount of space, in bunk beds, et cetera. So there was guidance that was given for shelters that they needed to take some of their shelter beds offline, meaning they needed to distance the beds and things like that. So number of shelter beds in some cases in some communities declined. Also, there was a need for individuals who may have been exposed to COVID, who were tested and waiting on results, or people who did test positive. Obviously, they can't stay in a congregate shelter and affecting, you know, other guests at that shelter. So there was a need to find other places within the community that they could go. Sometimes that could be in a motel situation where we would consider that non-congregate shelter. Sometimes they were able to find other facilities, formerly closed nursing homes or other kinds of facilities that have been vacant that they could repurpose for that need. And so they were able to create, you know, space where people had their individual rooms, access to the individual restrooms, et cetera, so that they could either quarantine during and recover from COVID and not have exposure to other people that would normally be in a shelter. So that's sort of what non-congregate shelter is and why it was necessary during the pandemic.
Good, thank you, Paula. I think now we're going to move on to the last few slides that we have. Thank you for all those great questions. Sorry if we couldn't get to all of them. If there are some other things you still have questions about, you do have the opportunity to reach out directly to our presenters through the contact information found in the chat, but also to contact our organization as well, if that would be appropriate. So thank you very much for that. At this point, beyond an overview of where things stand with respect to the data and the programming that is currently available, we wanted to talk about the elephant in the room, and that's COVID-19. It's been a difficult year for many of you working in the field. We wanted to spend a little time talking about COVID and helping to bring into focus what we believe are some key things to keep in mind as we go forward. So as we're looking at COVID, we have an opportunity to really make change. We know that there has been a silver lining in some ways with respect to COVID because it's helped us to attack the issue more directly in different ways. So when we think about how we're serving folks in communities across the state, and we're thinking about new ways, new collaborations, et cetera, et cetera. So we want to use COVID-19 as that opportunity to be thinking about how are we keeping renters and homeowners safely in their homes, even if they're not able to make payments. We want to make sure that the number of individuals experiencing homelessness doesn't increase as we go forward. We want to make sure that homeless service providers have the resources and the funding that they need to appropriately serve the individuals experiencing homelessness during a health crisis. We know it's extremely imperative, especially when we have COVID impacting our population. We want to make sure that individuals experiencing homelessness, including those who have survived COVID-19, have access to appropriate long-term health care. We understand the importance of having access to health care, but when you're homeless, we know it creates exponential problems. We want to make sure that that stays to the forefront. We also want to make sure that Michigan is investing in affordable housing to get us through the crisis, but also for whatever comes next. We know that there's a housing crisis. There's been a housing crisis for many years, and COVID-19 has really exacerbated that and brought it to the forefront. This is an opportunity for us as we go forward to think about how we can leverage the attention that has been generated to support the development of affordable housing throughout the state. Next slide, please. Thank you. So what can you do now? It's really important for us when we think about the Homelessness Advocacy Day that we take into consideration policy priorities. And so we have developed a list of priorities that we think are very achievable and things that will put the light on the things that are most important for us to be the most impactful as we go forward in the year ahead. So we're talking about creating a source of income protections. Landlords and renters benefit when housing subsidies like the housing choice vouchers are available, and then protections against denials based on the income source that individuals have will make a difference in keeping people housed throughout the COVID-19 pandemic. We also are looking at funding the Michigan Housing Community Development Fund. We were looking with great anticipation at the federal relief, the most recent relief round, where there was an opportunity to have additional dollars that could be added to the Housing Trust Fund at the federal level. That's not come to fruition at the level that we would like. So that really tells us that we can't rely on the federal government to be able to infuse significant capital into that area at this point. So we have to think about how we can do that at the state level. How can we make that a priority and see that resources are made available specifically for the Michigan Housing and Community Development Fund and have an ongoing dedicated funding source to ensure that that's going to be something that's available not only this year, but in years to come, to be building the affordable housing that's necessary in the state of Michigan. And lastly, updating and increasing funding for the emergency shelter program. It's something that was referenced by Paula, was also referenced by Jerry Leslie as well. And one of the key tools that we have with respect to sheltering, we have been fortunate to see some increases over the last several years with respect to that funding, but it is not enough. It's not adequate. The state of Michigan falls well behind the national average when it comes to the resources being devoted to those emergency shelters. So we are focusing on that and trying to get an additional $2 million included into that pool that's available. Next slide, please. So we're in the home stretch here. Michigan can lead the way. This is an opportunity for us to think about investing in affordable housing, in homeless services, and in the programs that open paths to long-term housing stability. That's really what the end game is. How can we provide long-term housing stability? So we want you to be our partner. You are our partner. You are here now. You're listening to these presentations, and you're committed to being a part of the solution going forward. So we'd like you to reach out to any of today's panelists to learn more about how we can work together. If you are interested in being a part of the campaign to end homelessness, please contact us. But we more than ever need you to reach out to your elected officials, to be talking to them about these issues, because we all need to share our experiences and our knowledge so that we can impart upon elected officials the knowledge they need to have informed public policy decisions. So with that, we are at 10:01. I'm sorry I've gone over a minute. There's a significant penalty for me for doing that. We're going to be moving to a review of the Advocacy Day priorities, and that's going to be on the Zoom platform. So all of you who registered would have received the agenda that has a link to that Zoom meeting. Also, I think we were going to drop it in the chat as well. So would like you to move into that platform so that you can participate in the review of the Advocacy Day priorities in greater detail. With that, I want to thank you for being a part of this portion of the event, and thank all of our presenters for being here today and joining us in helping to educate and motivate folks who want to make change in the state of Michigan. So thank you all very much.